So why should we bother about this concept of integrated health? Whether they know it or not, GPs all over the country this month are signing agreements with each other and with NHS England about how to get funding for aspects related to integrated health. Don't know if any of you know about this. Because what you want to know is how will it affect you now, in a few days, in weeks, in months, in years after. You want to know what you can do about it and how you can get involved. So what I'm going to do today is talk to you about integrated health, which is much like the American term integrative health, which you'll find in all the research and all the writing about it. And I like to believe the definition includes three things. It includes individualized healthcare, it includes using conventional and complementary therapies that work, but also I believe it should include taking into account all aspects of health, not just physical health, psychological, and the social aspects of health. So the physical, psychological, and social aspects of health. So how I'd like to talk about integrated health is by telling you a little story about myself and my journey, and from that explain integrated health, so that you can apply this knowledge and this new insight that you'll get and what you gain today to your everyday work, and take steps towards perhaps a different era, different stage in development of complementary therapy. So I'd like to start. So thanks for inviting me back to Bristol. So I'm glad I'm visiting Bristol again, because I first came here over 20 years ago to visit my friends at the time who were studying civil engineering in the university here. And I was studying medicine in Leicester. And I've always been curious about other things. So what I did was I decided to attend some civil engineering lectures and some law lectures, which I wasn't supposed to, obviously. Security was a lot more lax in those days. Despite all this, despite all that, I can't for the life of me remember the talks at all. But it's okay, because I don't blame myself, I blame the speakers and the lecturers. So this time, I'm giving the talk, I'm giving the lecture, so I've brought some toys and some props. And if anything else, you remember this. So not many people have seen this before, and I'll show you something different. So these are metronomes. Right?
Do you hold them up?
Well, it's more about, it's not just looking at them, it's about listening and hearing what happens. Okay, so they're set for the same time, and they're set at the same time. Otherwise, this will go very wrong. Same timing. So, those of you who don't know what metronomes are, my son uses them when he plays the piano for timing. What happens is I set them off. So that was pretty quick. Let's start them at different times. How about that? And if we just wait, and not just look at it, but listen and hear. And I promise you it'll be worthwhile in a while. Because some things are worth waiting for. So listen. And sometimes things take time to just sink in. So I'd like you to just listen and then watch what happens. So very early on, what happened is I set them at different times, and they synchronized in time. You can set them differently, but if you listen carefully, what will happen is they'll move ever so slightly differently. So the same timing. We'll watch. This makes my talk a lot shorter as well. Amazing, isn't it? Yeah. Amazing. You all hear that?
Yeah. Yeah.
Wonderful. So what is that? So that's a concept that you might have seen called that. Entrainment. Entrainment is a concept in physics. It's a phenomenon that happens in physics. It's no one knows how it happens. We know it happens. We know it happens in all aspects of life. Why am I talking about physics? What does physics have to do with massage, with therapy, with complementary therapy, with conventional therapy, with human interactions? Well, entrainment occurs in all aspects of life, right? Brain waves entrain. Having told you a story, very quickly they've proven that brain waves all match. So everyone's thinking the same thing. If you listen to a story, everyone thinks the same thing. I mean, there's always some of you who won't, but most of you will. And the other things that entrain are heartbeats. Right? Heartbeats entrain. Breathing entrains. So if you're in a room long enough with someone, your heartbeats match, your breathing matches. And if many of you are women, I don't know if you've ever lived with other women, you'll find that your periods synchronize. You have periods at the same time. It's all part of the same phenomenon. And if you stay with me towards the end of this, we'll talk about this, we'll have another experience with entrainment. Now let me state again, that after a few minutes with someone, and it's inevitable that your heartbeats will entrain, that your breathing will entrain, and then you'll notice that you get this amazing rapport with someone. You know, that relationship that so many of us recognize as deep empathy. That some people begin to see what they see, feel what they feel, and think what they think. And the only thing that really stands in the way is either you or the person. It's interesting, isn't it? Why did I talk about entrainment? Well, entrainment shows that there is no separation between the sciences and the arts, between physics and biology, that we're all connected in a much deeper continuum, that there's no conventional therapy, there's no complementary therapy. There's just a continuum of health. So to illustrate the rest of my points, I'd like to tell you a bit of a story, a bit of my story. So I trained as a doctor because I got excellent grades. So I did exceedingly well, learned a lot, spent a lot of time in my room. And yes, I was very boring. But yet, became a GP. When I became a GP, in the first year, within the first month really, I realized there was so much I didn't know. No one taught me about soft tissue problems. No one taught me about how to address minor mental health issues. All I knew was how to refer and how to prescribe. And referral resulted in long waits of at least 2 months. It's getting longer again at the minute. So we'll use musculoskeletal problems. No one told me it made up 20 to 25% of everything I would see, right? And we had no training on that. And then that led to more problems, because I prescribe anti-inflammatories, then I'll have to prescribe antacids or proton pump inhibitors to protect them from stomach ulcers. And then I prescribed opiates, I prescribed codeine, tramadol, sometimes I prescribed morphine. I was young, everyone told you that no one should be in pain, the drug companies told it to us, our books said it to us, the WHO said, this is your ladder, keep going up. The ladder, there's never been any research to step down on the ladder, only up. Didn't ask that question, didn't I? So what do we know now? We know opiate addiction was well underplayed by everyone. Now we have this, in America, the war on opioids, like war and everything else. But that's one good thing. So we were all, I was young, I didn't know any better. And what did they show about anti-inflammatories as well? They showed that anti-inflammatories slow healing. In sports medicine, we recommend against anti-inflammatories. So what was clear to me in the first year of being a GP was that I needed to improve, I needed to learn more, and I needed to do it quickly. So I'm being the sort of person, who didn't like to have my schooling get away with my education. I pursued a course in acupuncture. That was the first one I could find, and that was here in Bristol, yet again, with the British Medical Acupuncture Society. So gradually learned acupuncture over the years, and it taught me something different. It taught me how to touch the patient, to feel for problems, to learn a different sort of communication. To learn a different sort of communication that I'm sure you all know, but was so little, it's like learning a different language. And then over time, over time, my curiosity into other things that I didn't know led me to learn more about psychology, CBT approaches, NLP, hypnosis, which sort of was what I do now, but I've been doing that for a while. And then, other ways of talking and listening to people, incorporating all these things. And gradually, that made my practice a lot easier, more fun, and made me a more efficient and competent doctor. And I did what I knew. So I worked, and I worked, and I worked even more. So unfortunately, when that happens, the demands of home life and medicine took its toll, and I developed Bell's palsy. So Bell's palsy is a paralysis of your facial nerve. So one side of my face was completely paralyzed. It was a severe one. It didn't get better. 90% of the time, it gets better within 4 weeks, 95% of the time, and nothing happened. And so I took 3 weeks off and went back to work. 4 weeks passed, 6 weeks passed, 8 weeks passed, nothing happened, and 12 weeks passed, and nothing happened. So I got a little depressed and low and down, because of how I looked. It's ridiculous. How could I be so vain? No, I could let myself get this way. What had I done to deserve this? I don't know if any of you can relate to. Yeah. I must say, I was curious about being unwell, and that was good because I learned a lot. So then, out of the blue, I received an invitation to attend an advanced NLP course. I had been waiting for a long time, so I've been waiting for this course for a long time, and I declined it as I was so low, so depressed and down. I know I'm being a bit of a baby, but never up to that time experienced ill health. I always had my health. Yet this course, came knocking on my door again, and the person leading the course said that he'd help me personally with my issues while I was there. So I couldn't make any more excuses, so I had to go. I don't know if this has ever happened to you, when that calling comes and it calls to you and it just gets louder and louder, and you have no choice but to listen. No choice but to hear that deeper calling, to heed it. So then I thought, at least if I went, I'd get a bit of therapy, because sure as hell I wasn't going to see my own GP. No, I wouldn't let it on how weak I was, would I? I don't know. I'm sure we've all felt like that. So I went on this course, and little did I know the whole few days was entirely in hypnosis. And in an instant, on my second day, my face began to move. I snapped out of the trance I was in, and I was speechless. I was stuttering, and this marvel, this miracle, this magic that was occurring to me. So, and everyone in the room had witnessed this. It's crazy. So my face was moving. My face is moving now. So it shattered everything I knew that was possible. No, reality would never be the same again. All my teaching said this was not possible. So how could words and thoughts change something physical? How could words and feelings regenerate my nerves like that? I had seen what I thought to be miracles happen when I did acupuncture, with pain and with function. They'd be in pain and they'd walk out and they'd be fine. I'm sure you've seen the same thing. But it didn't make things work again. Surely it wasn't possible. Yet undeniably, my face was moving. Now, my face is not entirely back to normal, but I have a smile, a Duchenne smile, so a crinkling of my eyes when I smile. And it's a miracle. All I can say is open yourselves up to the possibility, and the impossible begins to become a reality. So in that room, I made alliances with Dr. Naveed Akhtar, who's one friend now, and together we shared information about that we've been accumulating for years on hypnosis, health, healing, and over the subsequent few years, we studied for hours every night, practiced every day. When I'm still a full-time doctor, I work 50 hours, 60 hours a week. Continue to do that because that's just the way we do it. It's a bit stupid, isn't it? So many doctors are part-time now, but that's the way we do it. And so we went to different health conferences, or separate health conferences in NLP, hypnosis, acupuncture, anything else we could find, really. So we met people who weren't doctors. We met people who were helping other people successfully. We met people using methods that in the past we had scoffed at as doctors. You see, one of the things about strict regulation and adherence to evidence-based medicine and guidelines does is I believe it stifles innovation. And stepping out of the box and looking, and it also, it stops you stepping out of the box, looking at people as individuals and then developing your own way. So, but we learned from that, and we sought now to treat people as people and to learn everything from everyone. So we learned that these miracles that were happening, people were in pain for months and years just by conventional therapy, could improve easily, effectively in the long term, which were with all these approaches that are relatively easy, relatively safe. And we learned that there were people who knew how to do these things. They could teach these to other people, and they were teaching it to other people here. And we learned that people we treated were receptive to these things when you talk to them about it. So most doctors don't talk. Have this fear of talking to people about complementary therapies. The fear comes from the fact that they don't know about it, don't know anything about it. So we thought, what can we do about this? So this led to us setting up. Oh, that's my face. Oh, take it away. So this led to us setting up the Integrated Health Convention, where we get doctors, conventional therapists, complementary therapists, together to have a forum where we can learn, share, and connect, much like this, but with doctors and therapists. And last year was amazing. Doctors were there saying, "Why didn't anyone tell us these things existed?" And the therapists were saying, "Oh, why are doctors interested?" And there's nothing. There was, I think, lots of misunderstandings that were allayed and fears, and people started to work together. So I urge you to attend this year's Integrative Health Convention, where in October on the 5th and 6th at the Park Plaza. I'll put some details up later. And the MTI, again, will be coming to represent massage therapy. So we have different forms of therapies that we talk about, ranging from aromatherapy to acupuncture, Ayurveda, yoga, TCM, reflexology, mindfulness, hypnosis, just goes on. You get to choose, and it's like a buffet of everything. If you're ever interested to learn, but also to meet the people who are doing it. And we've got people talking about how they successfully integrated it into the NHS system, and they work with the complementary therapists. So very strangely, as these things happen, last year we got invited to join the Council of the College of Medicine. Now this is really important because they are the pioneers of social prescribing. And social prescribing is now national policy. As of April this year, GPs are funded 100% by the government to have social prescribers. That means the government is funding these people called social prescribers. Now, what is social prescription? Why should you care as complementary therapists? Why is it so groundbreakingly important? Well, first of all, it's the first time we've ever recognized health as physical, psychological, and social. We've never actually done anything on national policy with regards to social care. I think we talked about David Cameron's Big Society, talked about it. We never actually put our money where our mouth was, and now it's there. And what's happening now in May is that the money's there. It's waiting for doctors to get, but they haven't set anything up because they came up with it in January. In May, all of us have to sign agreements with ourselves and each other, form these GP networks to access the money, and then from there we're thinking of hiring people in June or July everywhere. So where I come from, they've already got something in place, and so our money's going to go to them. So now, social prescription comes from the basic assumption that people who are socially isolated tend to consult more and feel more unwell. And there's a lot of data that shows this. It's common sense, isn't it? If you're lonely, it doesn't mean you can be in a relationship, you can be in a family and your friends, you can still be lonely. If people don't understand what you're going through, you can still be lonely. So the way it works is that social prescribers are referred patients by doctors, and in some areas like mine, nurses and other allied health professionals. These patients may include patients who have recently moved to the area, many of the people come down to the southwest that have come down to retire, and then to sell up, they don't have a mortgage. They're not necessarily resource poor as well. Some people, yes, they need it on NHS, but many people are not resource poor. They just come down and they're lonely, and they're seeing us a lot. I can tell you this. Personal experience. And what you do is you refer to these people, and then from they meet with the social prescriber, comes to them, sees them on a one-to-one, and they may be different, they may not see people one-to-one eventually when the demand is so high. And then they introduce local activities which are usually free. So in the voluntary or private sector, it can be voluntary or private sector, such as volunteering, gardening clubs, paint art classes, cooking classes, walking groups, other social activities. Sometimes the patients who are referred have not been out for a while and they're reluctant to go, and these social prescribers sometimes go with them. They say, oh, we'll come with you for the first session. And then they go there and they meet other people, and they say other people are going through the same thing as they are, and things, then they might decide after the taster sessions to go on. Now certainly, this has changed the landscape of general practice where I work. It's the only thing that's in the last 13 years as a GP that has changed the amount of work that I do. And we can't account for it other than this. And it's the people who come to you over and over again. Suddenly someone's come to me and she used to smell, the occasional person who comes in and they don't realize, because they're living on their own, that this is all happening to them. It's alienating them. And they didn't smell. They start volunteering, and they say, oh, and she comes in and she says, people are talking to me. I'm part of the community now. People used to just ignore me and think I'm a bit strange, but now, I'm part of them, and they stop and chat, and it's changed her life. She doesn't come in to see anyone anymore. She doesn't take any of the tablets she used to be on. That's just one person. We've got multiple people like this. Right. And what we've learned is that it took them so we've had it for them for about 2, maybe 3 years now. It took them the first 12 months, took social prescribers the first 12 months to find out what was going on locally. Because there's no training, there is some training for it now, but no one's ever done this before, right? So what's going to happen is they're going to start finding their feet, and they're not going to do, the money's there, they don't know what to do, they want to help, but they just don't know what to do. And so where do complementary therapies come in? So it took, like I said, over 12 months in my areas to establish a list of people who they could, and activities that they could refer to. And they just weren't aware of how much was going on locally, right? So they are mainly a local resource, which is why they talk about these GP networks, which are bunches of local practices just bunching up together, 30 to 50,000 patients. So how I see the complementary therapy helping is perhaps giving group taster sessions that are offered and often, the taster sessions are for free, things like yoga, exercise classes, initial sessions with therapists, and free seminars to attend, things like that. So one thing for sure is that many introductory activities, because it's part of the NHS, usually have to be voluntary, usually have to be free. However, like I said, the people who've been referred to in my area, they're not necessarily resource poor. And if they really enjoy it and they see, they might decide that instead of smoking or drinking, they might actually decide to go to those classes, have a massage, see other people, and then from there they make friends. So I urge you to find the social prescribers in your area in the next month or two. So we're talking about maybe July is the time that people are going to start hiring people. And as they are formed, you can find out more about them from your GPs, your own GPs, because they are a local resource. And there will be one GP who knows a bit more in the practice about it, because not everyone can attend the meetings. So speak to them, and you design activities for these most vulnerable patients, right? These most vulnerable people who need your help the most. And I think it's a wonderful opportunity, to be able to offer help to those who need it the most, to those who are most vulnerable, and those who are in need of the greatest assistance. So it's an opportunity for you as well to link with conventional therapy, speaking to the social prescribers as a way to maybe suggest going into doctor's surgeries, to introduce these professionals to your concepts and start sharing your success stories, your testimonials, and build relationships. So I know these things work, I've seen them work. They don't necessarily understand what you do. And so just by introducing these things, I think people will enjoy it. And there's some data already emerging that social prescribing, from social prescribing, that people who are offered this prefer, if they're given a choice, they prefer to choose complementary therapies on top, above and over normal activities, the other things, conventional things. So what do you do to make yourself more credible? Yeah? What do you do as therapists to make yourself more credible? So I can tell you this, doctors aren't necessarily worried about your qualifications. What they're concerned about is your regulation. They're concerned about your insurance, because that's what we're concerned about. That I wouldn't dream of practicing without insurance. And they're concerned that that what you can treat, right? And they want to know, more importantly, what you can't treat. They want to know that you know the limits of your competence. And that's what we do. I train GPs, and I've done so for quite a few years now, and junior doctors and medical students. And we always say, the worst thing you can do is not ask for help. The worst thing you can do is just carry on just muddling your way through. And then we want to know that you're happy to refer to health professionals, that you're happy when you're unsure, and everything's, if you think you're unsure, then that's the thing to do. So the other thing that's happening locally are these red flag courses. There are red flag courses, and I'm sure the MTI will, if they don't have one, will design some about red flags, yellow flags, things which we expect people to know about. And I know there are some courses which even teach massage therapists to recognize skin cancers. Down in the southwest, we have the highest incidence of skin cancer in the country. Farmers who might actually go for massage. Apparently, the county show in Devon is the highest incidence of melanomas and skin cancers that the dermatologists find. Men don't look at their backs. Women have eyes behind their backs. They see everything. So I have no idea how. Men never look. So they teach you these things because you've never seen one. You don't know what you're looking for, do you? So I hope you've enjoyed that. So I'd like to just go through a summary of what I've said. I'd like to share with you a few things from my talk again. So there's no separation between the sciences and the arts, right? So in health, there's no conventional, there's no complementary, it's just a continuum. And we should strive to accept that. And it's the same the other way, you as doctors, it's the same. Conventional therapists should accept that there is just a continuum of health. Anything I have to say is to listen to your calling. Hear that calling, heed that calling. Because he'll come knocking on your door more and more and louder and louder. And your life will be richer and more fulfilled for it. So heed it well. And you may well go on the rest of your life, because if you don't, you may go on the rest of your life regretting it. The other thing I have to say is to open yourselves up to possibility. Maybe, just maybe, the impossible may happen. And there's one thing we have learned, it's that magic and miracles are everywhere, and they happen all the time. But you have to look for them. So remain curious and believe in better. Ask the questions that people don't. Your eyes will open up to a whole new world. Make alliances with the people who have similar interests to yourself. Make alliances with friends, in events like this. People who are interested in what you do, people everywhere. You never know what might come of it. We started a conference, we got invited to lots of interesting things and doing things that we never imagined. So your life will be enriched by all these alliances, these friendships. And treat not just the physical, but treat the mental, the social aspects of health. Health is individual, it's holistic, so what's important to one person is different from what's important to someone else. And treat what the person deems to be important to them, and sometimes whether they know it or not. And attempt to do something greater than yourself. Be part of something greater. Be that coach, that mentor, that teacher, that therapist that your that people need, the people you treat need. And make alliances with friends with doctors, nurses, other health professionals, complementary therapists who think the same. There are many out there. Speak to the doctors, speak to the nurses, speak to the social prescribers, the health policy makers. Seek them out, speak to them, and speak to the people. Let them know what you do. That's important. Let them know what you don't do. Let them know that you understand what red flags are, yellow flags are, and that you can refer to people if they need referring to, if you're unsure of anything. If anything's beyond your scope of expertise. I can't stress that more. And finally, don't let your schooling get in the way of your education. Some things will suit you better. Some things will catch your fancy. And come to our convention in October. It's the Integrated Health Convention. Learn how people are working together, making alliances. See what other people are doing and sharing with you. And take what you need, what you'll find useful on your journey, because all of us have a different path. And you discard the rest. So never stop learning. Learn and live your story. Live your purpose. So my hope that is, if you do these things, that not just for you, but the next generation and hopefully the generations to follow will live in a far better world. Thank you. Thank you very much. Listen to your claps. Yeah? You don't act it. Can you hear the clapping?
Yeah.
Good. Thank you very much.
Thank you.